If you look at a tooth, the tooth is not always flat, right? There's a lot of elevations and depressions on the tooth. Sometimes when you have some food which can be very hard, can have these sharp objects in the food, like a stone in the food, can act as a wedge and then actually crack a tooth open. So is it possible to save a cracked tooth? What we need to understand is when a tooth is cracked, the depth of the crack, where the crack is, will determine whether we can save the tooth without extraction or not. When the crack is not too deep, it involves only the superficial surfaces of the tooth, like the enamel or the dentine, then in that case we will always be able to save the tooth without extracting. When it goes to a deeper layer but the crack is not involving, it's not a through and through crack, it is not starting from one end and coming to the other end, probably a root canal and a crown will help to hold the tooth in place, and the root canal will help to prevent any sensitivity on the tooth. So these instances the tooth can be saved, but sometimes what happens, a crack will chip the tooth. The tooth will not break, but it will only chip the tooth. So portion of the tooth is lost because of the crack, but entirely the large structure of the tooth remains intact. So in those instances also you'll be able to save the tooth. But only when instances whether it's a through and through, actually the crack splits the tooth into two, then extraction will be only choice. Otherwise we'll be able to save the tooth. Even a cracked tooth can be also saved.